Good day, everyone. I am Richie Arceo, 54 years old, living here in Angeles City. It's my second session for the under eye treatment today. What they did po last time is, I have this eye bags. So, yun yung gusto kong ma-treat para medyo malesen yung pagkamaga. So today, I'm expecting po na I'll be seeing great results. Although I've seen result na po, nabawasan na ng konti yung parang may bag ako dito under my eye. And right now, so this is my second session and I'm very, very excited na mapaganda ni Doktora. Yun lang po. Have a great day. Don't forget to subscribe and click the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a part 2 of the so-called periorbital rejuvenation for Ma'am Richie Arceo. Welcome back.
Good morning. Good morning, Doc.
Good morning. Good day.
Good day.
And we've done a procedure like 5 months ago, the so-called under-eye ultra-call for rejuvenation to improve the puffiness under the eye, to tighten the skin. Now, it is recommended that we do a follow-up treatment for the so-called ultra-call. And it's already like a 5-month period time. So you can do a follow-up treatment 3 months to 6 months for that one. So this is a part 2 of what we have started. And we also did the temple filler using our volume hyaluronic dermal filler. So right now, assessing Ma'am Richie, okay? So in the under eye area, we still see that skin laxity, still some fine lines there, and a bit of the tear trough. Okay, so ultra-call treatment would really need a follow-up procedure. Okay, it's like in sessions. Okay, we left those ultra-call PDO powder filler inside the skin tissue, but the requirement is to do a follow-up for that kind of procedure. So for today, we want to do a complete rejuvenation around the eye area, tissues around the eye. So it's not only in the under eye, the infraorbital, this part here. So not only in the temple region, but actually we already include the superior aspect here. If you see some brow ptosis or sagginess or even eyelid ptosis there, we already improve this part. Wow. Okay, because as time passes by, the upper area, the upper eyelid will sag down, drop down because of the weakening of collagen and elastin and the less production of those connective tissue fibrous proteins. So we can do procedure for that one. And another thing that we add, since it's periorbital, when you say peri, around, so that actually also includes the nose.
Yay.
So it's like around the eye tissue that you want to improve those kinds of anatomical tissue layers. So that will also include the radix of the nose. Yeah, right? You know, Ate Rich, even the nose will age.
I know.
As time passes by, tissues of the nose, the bone, the cartilage, it will be like absorbed gradually. Nagsishrink din yan, it atrophies. So over time, you'll notice nagwa-widen, nagdo-drop down because of aging. Okay. So tissues around the eye area, they're so-called the descent of fat tissues or the so-called atrophy, or we call it deflation of tissues, and degeneration. Yung mga collagen elastin natin na degenerate. So that's the aging process. So what we're doing right now is restore our youthful condition of the tissues. It's like regenerate it again and kind of restore the original position, yung mga nag-descend, and also like restore the volume, yung mga tissues na nag-shrink. So it's just reversing the aging process. And Ma'am Rich is still young. How young are we? Nasa number
50.
Yeah. Yeah, nasa dekada ano po kami.
Dekada.
Yeah, golden.
Golden.
Ayun na po. Never mind the age. Okay. So what kind of procedure, what treatment, we'll show you when CSA Medical Aesthetics return. So we are back. We're doing the so-called periorbital rejuvenation. We'll be starting at the infraorbital section, this part here, okay? So we want to correct the skin quality here. We want to do tightening and firming and also improve further the tear trough and some of the volume loss there and some of the fine lines that we have, okay? So we want to use right now our so-called PDO threads to improve further the skin quality, the so-called skin elasticity. Okay, our PDO is known for giving that collagenesis or restoring the collagen and elastin tissue matrix, okay? So our entry point will be here. I'll be making a tiny injection of our anesthesia. So Ma'am Rich, this is just a lidocaine, okay? Tiny prick only. There you go. You're good? Yeah. And then we'll make an entry point there. And I'll be using our PDO gauge 30, 25mm length. So these are just fine strands, single filament type, okay, of PDO. And then I'll just glide it into the skin tissue area here. So this is just like a short type of our PDO eye thread. So I can combine it later on with the so-called derma spring, which is a 40mm. So we'll do a combination like a sandwich method at this part. Okay, we're targeting the dermis and subdermis layer where you have your so-called fibroblast cells. This type of cells are the ones that will synthesize our new collagen, like collagen type 1, collagen type 3, plus also develop our elastin again. Plus the fibroblasts are known for also producing the so-called hyaluronic proteoglycan type of molecules, okay? So we'll just use the same entry point, okay? There were like videos I did show that I had multiple entry points, and that was using my so-called super tornado type of thread. The super tornado type of thread is a multiple filament type of thread or braided threads, but this one I'll be doing a combination like a monofilament plus the so-called derma spring thread. So now I have the second type, which is derma spring, that will be up to the so-called medial retaining ligament, okay? So this one is like a 40mm length. So a while ago we used the 30mm length, okay? Then we also have other type of thread for the under eye, the tear trough section, the so-called scaffold, okay? So this one is the derma spring. You're okay, Ma'am Rich? Okay, I'm just gonna reach the so-called, there you go, up to the medial retaining ligament. Okay, this part here. So again, this is a single entry point only. If you're using the multiple filament threads, you can make your multiple entry points as well. But for a single filament, you can use the same entry point, okay? Just glide it. So again, location is in the subdermis layer. You want to stimulate your fibroblast cells to synthesize those connective tissue fibrous proteins, okay? And I think this is a fifth one. So another one that I also add on my under eye is the so-called scaffold. So these are like combination types of our PDO threads. Now for scaffold, since this is like a 60mm length, so we want to improve the tear trough section here. You're still okay, Ma'am Rich? So I need another entry point, which is more lateral to the first entry point. So I'll make an entry point here, lidocaine, please. Okay, this one. So the goal is to improve support in the so-called infraorbital rim there. So a support here near our orbital retaining ligament. So this is a scaffold type, and we want to reach the so-called medial retaining ligament there, improving our tear trough. So this is a multiple type of filaments of threads. They're braided. These are the so-called braided PDO type of threads already. And a second one. Then we'll proceed with the third one, which we call inch threads. Still good, Ma'am Rich. Okay. So there you go. So we've done like combinations of our threads. Okay. We further improve the third trough area with the so-called inch threads. Okay, now you can like push the skin upward like this and then do your multiple puncture here. This is to support our retaining ligament here. Okay, so just an inch and we're good after this. Okay, so we've done the infraorbital section. So we'll pull out. There you go. So these are like very tiny thin filaments. Okay, so we've done infraorbital section using our different kinds of PDO threads. Now we mentioned a while ago also the upper eyelid section is ptotic or it's droopy. So we wanted to do a lifting effect here. So we have also the so-called PDO foxeye thread, whereby we insert it in the subdermal plane to do a lifting. Remember, this is just lidocaine. So we numb the entry point plus the track of the PDO threads. Okay, just to lift the upper eyelid area there. So we want to create this numbing too. Okay, so that's the first one. So we'll make this entry point. Okay ka pa? So I'm using a double cog PDO thread here. There are like single cog. We also have a double cog. Okay, we just glide it into that subdermal or subcutaneous layer up to the so-called scalp region. Okay. So we'll just go reach this area here. We'll add lidocaine. Rich, the feeling is kind of like having a pulling of the hair or tying your hair. It's just to lift your corner of the eye plus the upper eyelid there. Okay. Okay. Just a little bit more and you're gonna pull it out. Okay. Then a second one. We'll just do 3 pieces here. And then my final touch will be the so-called baby Botox just to get rid of lines and wrinkles. Okay. So that's the second one. Then we'll do puncture of the entry point. Okay. And this is the second kind of our double cog thread, lifting kind of thread. So we're gonna just glide it subdermally or layer 2 of our tissue layers, okay, up to the scalp region. Okay, so the feeling is like having like something pulling your hair. Okay. There you go. And then we're gonna pull it out. And then the third one, we're already in the tail of the brow. Okay, just a lidocaine. You know the lidocaine kind of, there's a sensation of a bit of a stinging sensation. And then after a while, it's gonna be totally numb. Now, the scalp region, it's kind of a thin tissue layer, so we wanna do like a so-called, there's a procedure we call hydrodissection. You can combine that with your tumescent solution. Okay, so this is the third one, the final one. Then we'll just improve the radix of the nose and do microbotox around the eye area for our final touch to improve those lines and wrinkles. Okay, this is the third one. Okay, and then we're gonna pull it out now. Okay, so then we're just gonna cut this fibrous strands here. So again, the PDO will help stimulate collagenesis as well as neoangiogenesis, improving the skin supply of our micronutrients. Okay, you did already multiple procedure. Then let's just improve the radix. Okay, so this is a lidocaine again. Ma'am Rich, okay, I'll just pinch your nose and just inject a tiny lidocaine, same as those previous ones. Okay, just a minimal lidocaine. Then I can do a lidocaine also on the entire radix section. If you can give me cannula with it. Okay, this is just a tiny prick. Okay, you're still good. We need a pinch prick. Okay, we pinch and then we pull the skin. Sorry, this is now your cannula. Okay, you can glide your cannula in the layer 4 of our nose tissues. Okay, this is just lidocaine here, just to create a tunnel for our PDO threads. Again, polydioxanone are types of absorbable type of suture threads that are used for regeneration of our face tissues right now. We've been used in aesthetics and cosmetics for a long time already because of their regenerative effect. So we're just injecting a lidocaine in the layer 4 above the bone and cartilage. So we have to really reach the so-called radix or nasiyan. Okay, so some medical terms there, Ma'am Rich. Okay, anatomical terms. Okay, so this one is numbing. Okay, then just a few of my so-called PDO Wyco thread here for the nose. This is just specific for the nose area. So we have different kinds of threads specific for certain anatomical region. Okay, we'll pinch and pull out. So again, this one, the second one. So we created that layer already, the tunnel or the space, second. And then a third one. So we're doing multiple combination procedures right now. Third one, fourth one. We can use up to all of those. Half of our PDO nose threads. Okay, we're almost done. Final one. There we go. Okay, so pinch and pull out. For our remaining procedure, microbotox, we'll just do it and we'll proceed to the left side of the face. So like a tiny Botox, okay, just to get rid of our wrinkles. Okay, this is treating the crow's feet and then also our so-called infraorbital wrinkle here, like for our orbicularis oculi muscle inferior part, and then a little bit on the glabella complex corrugator and the other corrugator. So let's do the opposite side. So we're done with the periorbital rejuvenation. Show the result to Ma'am Rich when CSA Medical Aesthetics return. And we're back. So we'll now show the result to Ma'am Rich. Ma'am Rich, here's our mirror so you can check already the outcome of our treatment. We have done multiple treatments for Ma'am Rich. We started with the infraorbital area using different kinds of our PDO threads. We had those single filament, the derma spring, scaffold, and some of the inch threads. And we also did like the so-called foxeye thread lift to also lift the corner of the eye area plus the corner of the eyebrow or the tail of the eyebrow. And then we also did the nose radix projection just to do some rejuvenation effect and also some microtoxin or the baby dose of our botulinum toxin to relax some of those like contraction of some of the muscles there and treat the lines and wrinkles. Okay. I also noticed on the forehead region of Ma'am Rich that this volume loss, this part here in the inferior aspect of the forehead area, most lateral part there, that one we can also improve with the so-called injection of our hyaluronic dermal filler so as to restore volume, because over time even our forehead originally it's projected anteriorly, but as we age it goes backwards like that, creating that concave shape of our forehead. So we want to restore the convex shape of that forehead area. So we'll do a bit of that filler injection in a little while. So Ma'am Rich, how are you? So far,
Ako ba to? Thank you.
So we have some post-op soft tissue swellings and injection marks. We did multiple injections there. Plus the lidocaine are still causing this bump on the skin. Okay, that's temporary. It's gonna go away in like 12 hours or 24 hours. So some of my patients within the day it's already gone, and some people the next day they still have a bit of it. Okay, and then normal to have the sensation of like tenderness in the surrounding areas, the injection areas, which are of course expected. These are injection procedures, so the following day we'll have some soft tissue swelling, tenderness there. We'll give you like medicines for anti-swelling, anti-inflammatory, something like that. So, any feedback?
I didn't know that. Maybe because of the eagerness.
Right, yeah.
And the passion, to look good.
There you go.
Parang, di naman masakit.
She's I've met her a long time ago. She's so pretty.
Yeah.
Okay. Now, we're in our age of 50s na. So, over time, we see the signs of aging. So, we just wanted to manage those aging signs, okay, and kind of still reverse it. We want to age backwards right now. We have science, okay. These are science is from our creator, okay. He was the one who made us, who made all our tissues, and we are gifted with these kinds of science and technology. We're just using them to glorify God as well, right? Yeah.
Right.
So in a little while, I'll add a little bit of my filler for the forehead section. And for now, so far so good, Ma'am Rich.
Yes.
Yeah. So how was the center, the nose? Okay, we didn't alter your look on the nose, okay?
I didn't notice, but
there you go.
Oh, yeah.
I just wanted a subtle effect on the nose, improve a bit the projection, just the projection. If you look at the profile, the lateral view, a 90-degree angle picture, so you'll notice the projection of that radix. So there's an angle, frontonasal angle, 130 degrees. That's the one we want to achieve, okay? So on the lateral view, I can already see the radix projection.
Yeah, meron na siyang
Right. And then we did a micro dose of our Botox. Of course, Botox, we wait for a week or two for the results to come out. Okay, so now your PDO threads, they will induce neocollagenesis in the span of 12 weeks time. So over time, you'll still see more improvement, more skin tightening, more firming as time goes by. Okay, there you go. Thank you, Ma'am Rich.
Thank you. Don't forget to subscribe and click the button.
Right. Do you have any social media that they could follow you and check how you look like after?
Arceo Rich, my Facebook account. Same
Arceo Rich.
Yeah,
there you
same
go.
with Instagram and
TikTok. Okay. Thank you so much, Ma'am Rich.
Thank
Okay. If
you
you
so
have
much.
any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. We also have Instagram, CSA Medical Aesthetics. Also what are the other, of course, our YouTube channel. Just click, subscribe. Contessa Salvador po. So, when it comes to natural beauty, you can trust the CSA Medical Aesthetics.